Hi, I'm Shay Haynes. I'm doing my presentation today for Nursing 375 in the BSN program at United States University. And my topic is insulin overdose prevention. My topic is for administrators and healthcare staff in a hospital care setting. First, I would like to discuss that insulin is prescribed for type 2 diabetics, and it's given either sub-Q or regular insulin can be given via IV. That's the only insulin that can be given via IV. When administering insulin, nurses need to be aware of the five rights of insulin administration, the 5 rights of medication. The first one being make sure you have the right patient, make sure you have the right medication, make sure you have the right strength, make sure it's the right time, and make sure it's the correct route. Also, you might want to verify the physician's orders and be sure and check the condition of your patient to be sure they can tolerate insulin. You can do an assessment, whether you do finger stick or blood work, to be sure that the insulin is going to be warranted for your patient. Insulin medication errors have occurred more often than any type of class of drug and can be detrimental. Even irreversible damages can be done to patients. So far, there have been little discussion about how to reduce insulin administration errors in patients from a nursing perspective. Here is the size of a needle. When you're using a valve, be sure when you're using your insulin needle that you choose the correct size for your patient. That also goes along with assessment. So be sure you use the correct size of needles, because that's important, whether you're using a valve or whether you're going to use an insulin pen. There are different sizes of pen needles and insulin syringes that you can use. Also, insulin is identified as high alert medication. Noted the seal on the insulin pen. It's a high alert medication by the Institute for Safe Medication Practices. You also have to be sure that you're using the right concentration of insulin. For instance, you have the concentration of 100 units, and at times you have a concentration of 500 units. You can even have concentration of 300 units. So it's very important to be aware of what type of insulin that you're giving. Also, there are many different types of they have basal insulins that you give to your patient. You have prandial insulins. So you really need to know your insulins. You need to know the peak. You need to know the when your insulin peak. You also need to know when your insulin you have the most insulin in your body. You also need to know whether your insulin peaks at all. You have some types of insulin that just stays steady in your body all throughout the day. Those insulin are your basal insulins, like Lantus or Levemir. Standardized order sets should be implemented instead of individualized scale orders. This is for administrators of the hospitals. In order to help prevent overdose prevention, you can start with standardized order sets. A scanning system should be in place for medication administration. Also, pharmacy should mix all of your insulin medication solutions and concentrations. Known contribution factors of insulin administration errors are transcribing, drug calculation mistakes, non-adherence to protocol, and failure in communication. Most times, insulin administration insulin overdose can be prevented. If you're receiving an order from the doctor, make sure you do a telephone readback process for telephone and verbal orders. If you have a sliding scale, be sure you follow the specific sliding scale. Facilities could also implement using a two-person technique to have two licensed nurses to verify insulin during this process. So with insulin overdose prevention, there are things that nurses can do as well as the administration or the facility can implement to help prevent insulin overdose. This ends my presentation.
Take a picture. Stop.